Hello and welcome to the channel. My name's Vincent and I'm coming to you from the UK. Now right off the bat, I'm not a doctor. None of this is medical advice. I'm just some random bloke on the internet. This may be the ramblings of a madman. In this video, we'll first hear from the professor about dosage, timing and scheduling. Then we will hear from Dennis Staceys, who talks about how it works. And then stick around to the end for a bonus from me. Here we go to the professor.
And then the amino acid is also, glutamine, is also the second fermentable fuel. Glutamine is the most abundant amino acid in our body. It's everywhere. So in order to, and besides, our immune system needs glutamine, our urea cycle needs glutamine, our gut cells all depend on glutamine. So if you go too aggressively on attacking glutamine, you also can cause metabolic disturbances in the body. So that's why we developed the press pulse theory of strategy. We can control glucose constantly because glucose is a non-essential metabolite. Our body does not need glucose. We can make glucose from within at very low concentrations. But the glutamine issue, you have to get the body into a ketotic state, and then we hit the glutamine just briefly, boom, wait, bing, so it's pulsed. It's like a pulsing. And that just, I have a few cancer cells here, they go down. Okay, then we let the glutamine come back, but not too many come back, just a little bit. Then they hit down, come back a little bit, hit down. And the next thing you know, gone. So again, you have to use knowledge of how do we kill cancer cells without harming the normal cells? And that's the strategy that we're developing as dosage, timing, and scheduling. That's where we are now. We're perfecting dosage, timing, and scheduling. And once we have those conditions perfected or modified, we'll be able to manage the majority of cancers with minimal effort. But
So that's the professor, dosage, timing and scheduling, and Den on
First,
how
of
it
course,
works.
acknowledging your story, Den, when I had heard about all this and further had conversations with Daniel and getting a chance to, look at this case study and walk through it, which we'll link to inside of the show notes, just feeling, so much, joy for you, for your family, for your kids. I don't have kids, but just imagining myself in that situation. And then also excitement for the larger community that's there that, hey, this is another brick that's being laid of an example of somebody successfully following the Seyfried protocol.
Right.
And being honest about how hard and difficult it is, not sugarcoating it, not telling people that this is some sort of, silver bullet that's out there, but that it takes meticulous work and it takes a supportive team. And that at least that will help a few people who are on the fence of trying to understand, should they do this? Should they not do this? Should they work with people? Are there other options on the table? That at least they feel like there's more information for them to make an informed decision.
Sure.
Right?
One of the things that I think is really important is we hear a lot about alternative approaches to cancer management or cancer treatment that have these miraculous outcomes. But one of the things that seems to be shared in most of these stories is no real idea about why we had this miraculous remission or this positive outcome. In this case, what happened in my body was exactly what was described in Seyfried's science.
Exactly what was described in Seyfried's science. Get that? Exactly what was described.
There's no misunderstanding. There's no question about why I got this result. And that I think is probably more exciting than the result itself. That you can look to the scientific literature, you can see what the experiments in animals show, you can see 100 years of science that very clearly points to what will happen in your body if you do this, this, and this. That's more exciting than the fact that it worked. I mean, it's exciting that it worked, but that we know exactly why and that it can be relied upon to happen in just about anybody. I think that's remarkable.
Absolutely well said, Dennis. Remarkable. So now for the bonus. Let's take a look here at this browser. That's our website, metcancer.com. And if you go to case reports, Dennis Staceys protocol. Scroll down, and there, dosage, timing, dosage, I'm talking to the wrong camera here, let me talk to that one. Dosage, timing and scheduling, Dennis's whole protocol there on metcancer.com for you to download and use to your discretion. Thank you for watching this video. I'll see you in the next one. Bye-bye.